Hello, and welcome to Crash Course. My name is Ria.
My name is Ashita.
And today we'll be exploring the psychological causes and effects of claustrophobia.
Claustrophobia is the fear of crowded or confined spaces. The word claustrophobia comes from the Latin word claustrum, which means a closed-in space, and the Greek word phobos, meaning fear.
Claustrophobia is a specific phobia, which is defined as an intense, persistent, irrational fear of a specific object, situation, or activity, or person. According to the American Psychiatric Association, the diagnostic criteria for specific phobias are excessive or irrational fear of a specific object or situation. Therefore, anyone who is severely scared of a confined place is considered claustrophobic.
The exact cause of claustrophobia is unknown, but according to theories, the causes of claustrophobia include damage to the amygdala, the part of the brain that interprets fear, a traumatic experience like being stuck in a tight or crowded space for an extended period of time, being locked in a small space as punishment by parents, or being left in a small space by accident.
It can be triggered by a number of situations or stimuli, including crowded elevators, windowless rooms, and even tightly knit clothing. What type of people is typically affected by this disorder?
Claustrophobia is seen in people of all ages. Studies show that women are more likely to suffer from it, that men and that children of claustrophobics are likely to have it as well.
Claustrophobics typically experience a fear of suffocation or restriction due to their illness. The fear of restriction can cause some claustrophobics to fear trivial matters such as sitting in a hairdresser's chair or waiting in line at a grocery store, simply out of fear of confinement to a single space. Another possible site for claustrophobic attacks is a dentist's chair during dental surgery, a scenario in which the fear is not of pain but of being confined in the chair.
What are the symptoms?
The symptoms include heart palpitations, sweating, trembling, shortness of breath, or a smothering feeling, a feeling of choking, chest pain, or discomfort. Often when confined to an area, claustrophobics begin to fear suffocation, believing that there may be a lack of oxygen in the area to which they're confined.
Oh my god, so how can I get treated?
Well, there are many ways to get treated, but cognitive behavior therapy is the most effective. Cognitive behavior therapy is where the patient is encouraged to confront and change the specific thoughts and attitudes that lead to a feeling of fear. In fact, a study conducted by S.J. Rackman shows that cognitive therapy decreased fear and negative thoughts and negative connotations by an average of around 30% in claustrophobic patients tested, proving it to be a reasonably effective method. Flooding is another way of treating this disorder. This is when the patient is exposed to their phobic trigger until the anxiety attack passes. The realization that they have encountered their most dreaded object or situation and come to no actual harm can be a powerful form of therapy.
8 to 10 weeks of treatment are suggested on average, but it also depends on the severity of trauma and phobia. People who have above average levels of intelligence when compared to the rest of the general population are more susceptible to the development of claustrophobia and other fears. Did you know that 5 to 7% of the world's population suffer from severe claustrophobia, but only a small percentage of these people receive treatment?
Wow, that's a lot of people. I heard that claustrophobia can negatively affect people's lives and relationships in many ways. I had a friend who was claustrophobic, and every time she went out with her friends, she would feel like a burden because they had to go out of their way to avoid small places like elevators. Also, her Indian community was not so supportive of her disorder and often viewed her as an outcast. It was not really socially acceptable for her to be claustrophobic. Friends and family could adapt and avoid small places when they're with her, but they didn't seem to make a big deal out of it. As more and more people are being diagnosed with claustrophobia, people are becoming more understanding. However, only time will tell how different cultures will learn to accept this disorder. Fortunately, over time, the girl's friends and family understood and slowly adapted their lives to accommodate her and make her feel more worthy.
I hope our society will learn to accept this disorder. I was reading about a young girl, Catherine, who suffered severe claustrophobia. Catherine had moved into a small apartment on the 6th floor in Brooklyn Heights, which meant she had to use the small, confined elevator to get to her apartment every single day. She shared that her fingers grew clammy, her chest began to tighten, and she started to flush. The space was so tight that even her clothes felt constrictive, making her rip off her sweater.
Oh my god. My friend who lives in New York was telling me that the city is the worst place for a claustrophobe. The city requires you to squeeze yourself into a series of small places, studio apartments, subways, especially during rush hour, elevators, office cubicles. Many claustrophobes have to climb a lot of stairs and wait for a less crowded subway train.
I wonder how hard it must have been for Catherine to attend social events or even social gatherings. But Catherine didn't give up.
Did she seek treatment?
She couldn't take climbing up the stairs every day to her apartment anymore, or making excuses to her friends that she had to get off the train because she needed exercise. Finally, she met Harvey Baker, a professor of psychology at Queens College, who had successfully treated New Yorkers with fears of water bugs, rats, and even math.
What exactly does he do?
He treats his phobics with something called the emotional freedom technique, a combination of acupressure, affirmations, and behavioral therapy. This consisted of Dr. Baker asking her to envision a claustrophobic situation and rate her anxiety from level 1 to 10. Then we would launch into the emotional freedom technique, a therapy not of talk but of tap. She would mimic Dr. Baker as he tapped himself on various acupuncture points. Catherine said that it seemed silly at first, but the third round she was usually able to lower her score. Although the treatment was helpful in the doctor's office, she was uncomfortable doing the same thing in public when she was on her own. She felt less stressed, but still could not ride an elevator at work every day. However, her motivation to stay in the city and keep going and living her fast-paced life was a feeling of excitement she felt each time she managed to take an elevator or a crowded subway. The struggle of taking the stairs, the longer, the harder routes, is what kept her alive. It was a challenge that uplifted her and allowed her to conquer any hardships she faced along the journey.